Mhm.
Good evening. This is Dr. John Bennett, broadcasting from Miami. Tonight, we have another in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, a neurologist from Toronto, Canada, and a world-renowned Parkinsonism educator. And tonight, Dr. Rana is going to talk about driving with Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
I forgot to ask you, is it snowing up there?
The snow is almost melting now.
It's
We have
all,
good weather these days.
we have something similar in common. We have no snow on the ground here either. Okay, let me start off with a question. Roughly what percentage of patients may be at risk when driving? What percentage of Parkinsonism patients?
Driving safety is an important issue in Parkinson's disease because driving is a complex activity and requires coordination of physical and cognitive capabilities of patients. So Parkinson's patients sometimes could be unsafe because of the symptoms of Parkinson's disease. They could have slowness of movements, they have visual spatial problems, executive dysfunction, difficulty with attention and information processing. And this could sometimes start in relatively early stage of Parkinson's, and it could correlate with the disease severity. About 1/3 of patients in some studies have been reported that they were involved in accidents and they were actively drivers. And symptoms like freezing of gait or freezing of motor activity or sudden onset of sleep, these are critical risk to the driving. About 20% of patients who were active drivers, they got into trouble because of freezing of motor activity. Freezing could happen at the start of the activity or sometime in the middle of activity, and it would involve many other motor performances beside the walking because the patients are sitting when they're driving. So the evaluation of the driving capacity of these patients it should not only involve the road test, but also a psychomotor assessment is important in these patients.
Very good. Does it only occur, do the problems with driving only occur later in Parkinsonism or in all parts, all stages of Parkinsonism?
In late stages of Parkinson's disease, it becomes a problem. But even in mild to moderate stage of Parkinson's disease, the drivers may make more mistakes. They may be less safe, and they might have some difficulty making turns. Some patients could get lost, and some patients may make such safety errors when they are changing lanes, and they might need more time to remember the route details, and sometimes they might need extra time to complete a route as compared to those drivers who are of the same age, but they are healthy. So these patients may have difficulty checking their blind spot and steering the car accurately and running it smoothly. So difficulty changing lanes and adjustment as they are going in the speed could be a problem. And some patients have the impairment of the visual memory tasks. So that may put them at a risk when they're driving. And because of aging population in Parkinson's disease being more common in elderly, so this is becoming a more and more problem, and it could have sometime a devastating effect, not only other people, but patients' own life could be at a risk if they make a mistake. And it is, although it is all the privilege which all of us enjoy. It's a freedom and independence. And some patients, when they are told not to drive, or most patients, they might feel a big big loss of their freedom and liberty, but I think their self safety and public safety comes first. And about 1/3 of the patients in some studies have been reported to be unsafe drivers, although they were previously approved to drive. They were said fit to drive, but when they went through further assessment, 1/3 of patients turned out to be unfit to drive. And the driving being a, a highly coordinated task. So with age, we have some difficulties in maintaining these coordination and doing synchronous actions. So it becomes more of a problem as you age. And these patients, they would drive more cautiously, but they are less confident. They have slowness of movements. They can't control the steady speed of the vehicle in a flow when they are going. And they can also have a difficulty because of their visual perception. Sometimes judging how far the signal is, it could be a challenge for these patients in some cases. And because their reaction time is slow and their motor skills also deteriorate with time, so it hinders in their proper driving.
Okay, what can help in determining the abilities of a patient with Parkinsonism to drive?
I think the information should be obtained from many different resources, such as caregiver or their family members or friends who drive, who sit with them sometime. The self, just depending upon the self-report of the patient, asking them and making a decision has a little correlation with their actual driving performance. So you need to have information from multiple resources to expect that patients would be able to determine themselves or make a right decision or provide a good information which would correlate with their driving status. I don't think that is the case. So relatives and caregivers should be asked questions about the driving skills of the patients, such as the caregivers could be asked if they feel comfortable riding with the patient when they are driving, or if they have noticed any unsafe behaviors on part of the patient during driving. Caregivers could also be asked if they think that other drivers are forced to drive defensively when the patients are driving to accommodate the patient's need. And they could also be asked if the patient reacts too slowly to the changing situation in a flow of traffic that could become a problem. And also, you could ask them directly that if do they think that patients are unsafe to drive. The patients could be asked if they had any accidents, especially since the diagnosis of Parkinson's disease, and if they have any difficulty turning and steering the wheel or pressing the gas or changing the gears. That information could provide a lot of knowledge about their driving skills. And also if they have received any recent traffic violation tickets or speeding tickets, or if they have any close calls recently, or if they had made any errors in making turns or changing lanes. That information could be helpful. Also, one important point is sudden episodes of sleep. The patient should be directly questioned whether they had any unexpected sudden onset of sleep while they were driving, and sometimes the caregiver could give that information too if they are riding with patient. So taking all information and putting in to the patient's background and having a frank discussion with them as well as a caregiver could help to reach some decision in these cases.
Okay. Is driving safety affected as Parkinsonism progresses? I guess you kind of partially answered that.
Right. Not only the symptoms of Parkinson's disease, but also the side effects of medications they are taking could make could make a negative impact on the driving capability of patient. And as patients advanced in Parkinson's disease, their number of medications increases as well. In the beginning, they may be just on one medication, and as the course of disease progresses, other medications may have to be added. So when they are on more than one medication, of course, their risk of so many things such as sleepiness or feeling foggy or difficulty paying full concentration or attention could be affected. One of the study by the National Center of Injury Prevention and Control in '99 did show that the motor vehicle accidents were the most common cause of injury-related deaths in patients aged from 65 to 74, and this was the second common cause of deaths in patients from 75 to 84. However, having Parkinson's does not necessarily mean that you have to quit driving right away when the diagnosis is made. But when Parkinson's disease is fairly moderate, I think the decision should be made with a careful consideration and discussion with the family member, patient, and maybe some other driving assessments could be done in these patients. Because as their disease is progressing, their motor skills decline, their reaction time becomes slow, and their attention and information processing skills are also affected. When a person is driving, the traffic lights are changing constantly. They might have trouble following the signals or keeping a proper distance from the next car. Could be a problem in these patients. And in addition to this, the patients, when they are started on the medication, on a certain medication, the risk may be higher, or when the dose of a certain medication is increased. And if patients have other symptoms such as difficulty falling asleep at nighttime, so they might have excessive daytime sleepiness. So that could be a risk for these patients. And if they are taking medications which can cause confusion, dizziness, and drowsiness, that becomes an additional problem in these patients.
Okay. When a Parkinsonism patient, when should a Parkinsonism patient consider to stop driving completely?
I think it may be difficult for a patient to do a self-assessment and decide when they should stop driving, or whether they are fit to drive or they are not fit to drive anymore. So because some people could be overconfident and they might overestimate their capability of driving, and they may not realize that they are not fit to drive anymore. So they should talk to their family members and friends and ask them about their own skills, that how they feel. And then they should listen to their concerns and see how serious are the concerns of these family members or caregivers. Patients, of course, they should avoid any congested roads, driving at nighttime or during a bad weather, because that poses them to an additional risk of getting involved in an accident. If patients have a close call and they don't feel comfortable driving, they should consider either stopping to drive or take a defensive driving course. They might contact their local driving center and see if they can get some additional training, or they can do some of the centers do a practice test, and they would tell you that whether you would pass or no. And some of the rehabilitation centers also examine driving. They do the cognitive assessments as well. But in case a patient decides to take a driving test and they fail, so their license would definitely be canceled. So it is really difficult for patients themselves to decide when they should give up. So I think a team involving the caregiver, patient themselves, or a family friend, after discussion with, of course, with the physician, could reach a conclusion relatively easy. The caregivers may have to convince the patient sometimes because they might not agree with the caregiver's opinion. And at other times, they may need help of a professional, such as people who do the driving assessments very frequently. And sometimes if you discuss alternative options with these patients, because if the patients are not going out too much anyway, or if they're going out with their spouse or a caregiver, they are driving, then probably they could give up easily. And sometime if they take the local public transportation and they consider this, or if they have a immediate family member available to give them rides, I think that helps that helps for the patient to reach that decision relatively easily. And as a caregiver, I think there is a more of responsibility to inform patients of their skills, which could be deteriorating with time, so that they can come to a conclusion.
Is there any notation put on a driver's license that the patient has Parkinsonism or no?
The driving license, as to the best of my knowledge here in Ontario, they don't say any information about patients' medical condition.
Oh, okay.
Patients could themselves could have a bracelet. They could have a wrist bracelet which they could wear, which could say either their disease or their medical condition. But driving license, it does not indicate.
Okay. I know this, we're talking about Parkinsonism, but I'm wondering if epileptics have something noted on the driver's license or no. Do you know anything about that?
No, epilepsy patients neither have any information on the driving license.
Okay, I guess we're getting off the topic a little bit. Okay, Dr. Rana, anything else to add about driving in Parkinsonism?
I think leaving just up to the physician, in my personal opinion, is a bit difficult, because physicians, they have a relationship with the patient. At the same time, they have to make all the decision by themselves. When patient is not agreement in the agreement, it could be difficult. I am thinking that a joint decision with a caregiver, patient, and a professional from the driving assessment would be easy on part of the patients to accept. The caregiver, as well as may make the decision of the physicians easy as well.
Okay, very good, doctor. That wraps it up for driving and Parkinsonism. Thank you very much. This can be seen at parkinsonism.tv. And stay tuned tomorrow night for another in the episode of continuing educational hangouts in Parkinsonism with Dr. Rana. Thank you, Dr. Rana.
Thank you, Dr. Bennett.
Good night.